Hello, everyone. I'm Kim Malcolm, the local host of All Things Considered on KUOW. Thank you for joining us for this, our third installment of our series, Stand with the Facts. Together with the Center for an Informed Public, our goal is to empower you, our audience, to be informed news consumers. We hope these conversations will help anyone watching to know more about what mis and disinformation is and how it's spreading. We have a toolkit for you on how to spot misinformation and combat it in our daily lives. More details on that in the links to this episode. We are taking your questions, so if you're watching live, please leave them in the comments and I will get to as many of them as I can. Since the start of the global pandemic, a lot of information has unfolded rapidly about COVID-19, and it is often changing information as we learn more about the virus. Many of us, me included, feel inundated with information about it, constantly seeing articles about COVID in our feeds. And as we look for answers to ease our fears, we don't always find articles with factual information. What is it about us humans, that causes us to gravitate towards information during a crisis like this pandemic? Well, I'm joined today by Carl Bergstrom, faculty affiliate at the Center for an Informed Public and professor at the University of Washington Biology Department. He has a background in studying emerging infectious diseases, and he also teaches a very popular class with Jevin West at the University of Washington on how to spot and refute misinformation. He's been described as one of the country's top experts during this coronavirus pandemic. And today we're going to discuss why we seek out information in a crisis and how we can avoid misinformation in the process. Carl, welcome.
Oh, thank you very much, Kim. It's great to be here.
Well, it seems to me that you are pretty uniquely situated to talk about this topic at this time. You're right at the intersection of global pandemics and misinformation. There's a lot of demand on your time right now. So thank you so much for being here. I just want to start at the beginning, if I can, with us as humans. We are learning about this unseen virus that could make us sick. It could even kill us. What happens to our brains when we're scared? Scared that we or our loved ones could die from a contagious disease?
Yeah, I think that, with anything like this contagious disease that we're dealing with right now, the coronavirus, when you have a new situation where you don't have all the information that you want and you don't have a lot of control, that generates anxiety. It sort of comes from this, absence of information and absence of control, and the coronavirus is throwing both of these at us. And so we have this whole natural, evolved, set of psychological mechanisms that produce anxiety. And what that does for us is, it's an evolved defense that motivates us to go out there and get the information that we need to take appropriate responses and to actually do something about whatever this, potential threat might be. So all of that kicks in, and what that does to us in the sort of information context is it makes us very interested in acquiring information however we can. And we try to figure out, what's going on? How can I keep the people that I care about safe? What's the latest breaking news? What do I need to know? And it sort of focuses us on the sources of information that we think might help us answer and resolve some of the uncertainty that we're facing.
So we're primed to want more information. We go out and find it. But what are the limitations that we're facing as we're sorting through and trying to assess the information that we're looking for, that we're getting when we're in that state?
Yeah, I think that's a great question. So I think we're not always thinking as clearly as we want to be when you're feeling anxious. There's a drive to get more information rather than necessarily as strong of a drive to filter the quality of the information. And so what we do is we often find ourselves, at least I know I'm vulnerable to this, and have had to teach myself not to do it just because of what I do for a job. You try to just keep pulling in all of the news sources and information sources that you can, and you can kind of get sucked into this whole cycle of checking on what's the latest, what have I heard, what is, this is what I hear here, what am I hearing here, and it can become rather addictive in a way that's not necessarily healthy, particularly in the long term.
Yeah, it does feel sometimes like you get this little hit and there's a burst. It's like it's cortisol, something is coursing through your system.
Right.
There's an instant reaction that you have, whether the news is good or it reinforces something you already thought. Am I wrong?
No, you're right. And I think, I mean, it's useful to think of all of these as evolved mechanisms that, where we have evolved to try to, I mean, these are ways for us to try to get information about perceived threats, but we live in a very different information environment right now than the one that we evolved in. And so we may get pulled into cycles that are not necessarily so healthy. I think one thing that really gets people about the coronavirus situation is we have a sort of a mental schema of this as a crisis, which it is a crisis. But when we think about crises, that schema often operates for crises that are sort of acute crises. They unfold very, very quickly. The world changes very, very fast. And so I'm thinking about wars or terrorist attacks or natural disasters. And in situations like that, knowing what happens, knowing what is happening up to the hour can be extremely important, because the world can really change radically when the second plane hits the tower or when the bombs start falling over Baghdad or whatever. The world's a different place than it was an hour before. And with something like COVID, it's unfolding at a completely different pace. And this is something that's happening in super slow motion compared to all of that. It's playing out over a period of months. We don't have these radical surprises. I mean, occasionally we'll be surprised by something smart or stupid that a government goes and does, but the disease isn't providing these radical surprises, because everything that we're learning about it is statistical. It's in levels of uncertainty, and that's how science works. And so it's not like you're going to have this dramatic, discovery that's going to happen in the next 15 minutes that's going to change the way that everyone thinks about the disease. Science just doesn't work like that. But we operate in terms of this schema of a breaking crisis, and so we think that we need that up to the minute news, and that can kind of tie us to information streams that are perhaps less reliable than ones that have been properly vetted and so on. And we can talk more about that.
Yeah. And you have been studying pandemics for some time. I know you were part of the response to the H1N1 or the swine flu. This was back in 2009. Of course, now you're involved in the response to COVID. And I'm wondering what good, reliable information looked like back in 2009, information that was being brought to the public. And what does it look like now? Any differences?
Well, I think that, what good, reliable information looks like probably hasn't changed all of that much. I tend to be a big fan of letting, for a pandemic or something like that, especially of letting the information come through professional journalists who are trained in, vetting information, in understanding the sources, in triangulating by talking to multiple people, letting that come through editors. And so I tend to be a very strong advocate of people relying on traditional media in whatever form that is, whether it's television, radio, newspaper. And so I think that, in both cases, you're getting some of the best information from those people like Helen Branswell, a reporter who's been doing flu for 20 years, has been absolutely critical in both, she was critical in SARS-1, she was critical in that, she's critical now in this. These are the really, really top sources, because they're coming from people that really understand what's going on, and they know who to talk to, and they know how to sort through the whole story. What's really changed a lot, I think, now is that we have also this entire other, information universe of social media that really wasn't a major factor in 2009 during the H1N1 pandemic. And so, it's become so natural for us to turn there, and there are big differences in the quality of information one gets in those two different areas.
Right, which brings me to my next question for you, which is about misinformation. What has it looked like during both of those health pandemics? And I'm talking about swine flu and now COVID.
So with swine flu, there were sort of, we had social media to some, but it wasn't all pervasive the way that it is right now. There were various internet sites. So with swine flu, we had, there were some conspiracy theories floating around and that kind of thing, but it wasn't a place where the social media wasn't a place where a majority of Americans turned to for their news at the time. And now, of course, it is. And so social media tends to be particularly vulnerable to the spread of misinformation for various reasons. I mean, basically on social media, we are all editors for one another. We all decide what our friends are going to see. And we don't have necessarily the training or the incentives that professional editors have to get it right. So I see a headline that seems that confirms something I believe or seems scary. I mean, we like to, we have really good intentions. We try to share information to keep our friends and family safe. And so if I see something really scary, I may just send that out. And I may even feel so hurried, I don't even read the story. I just see the headline.
See the headline, yeah.
This is, of course, something a professional editor would, with a sad exception of the recent New York Times editorial, that the professional editor would not do. In any case, so that means that the information that's traveling on social media is not particularly well vetted. And then the entire design of the social media ecosystem is set up to keep us engaged. It's not set up, so it's selecting for information that is engaging, that's exciting, that's stimulating, that's shocking. It's not selecting for information that's accurate. And that's because of the underlying economic model of how social media operates, that's just simply what that system is doing. There's of course layers of user interface design that make it work that way. And then there are these underlying algorithms that are, running sort of A/B experiments and machine learning experiments and figuring out what keeps us engaged, what makes us click, and so on. And those again are, not at a first order selecting for accurate information. They're selecting for things that draw people in and keep them on the platform. And so social media has become this very effective mechanism for spreading things that people click on. And those actually tend to be a bit disparate from the things that are true, because a lot of the true stuff is, new study came out and most scientists now are 3% less in favor of this hypothesis. But the story that's going to spread is, scientists discover this shocking thing.
Right. So the design to keep us scrolling, to keep our eyeballs on the feed and to take in the ads, that's problematic during a pandemic.
I think so. And you just hit on a really key aspect as well, which is that there's, your Facebook and Twitter are set up so they've got this sort of infinite feed, right? I mean, you can scroll as far as you want down, you can keep refreshing. And so it's so easy to get on there and sort of read what people are saying, and then you think, well, gosh, I've been reading this for an hour and I'm in crisis mentality, and so it's been a whole hour, so maybe something's new happened, and you click again, and the new stuff comes up, and it can keep you on there, and you can find it's 3 a.m. all of a sudden, and now you're feeling even more anxious about COVID when you log on to try to relieve your anxiety about it, and that's the dangerous cycle.
Yeah, no kidding. So it's just, I guess it's something to keep in mind. Talk a little bit about when you're looking for the latest information, you're trying to keep your family safe, your friends as well, you're clicking, you're sharing. I mean, you are building information, you're sharing information on what you're going to see later, right? On social media, what's going to be fed to you.
That's also true. Yeah, that's a really good point, is that there's feedback as well, because the machine learning algorithms are learning about what you're interested in, what you click on. And so the decisions you're making are then feeding back into, as you say, what gets fed to you later. And so that's also definitely an important component.
All right. So Carl, if I'm then my main curator of information on social, along with the algorithm that I'm feeding, can I consciously stop myself from getting a whole bunch of bad information? I guess what I'm asking you is, how do I stop being part of the problem?
Right. I think we don't know enough about how the algorithms operate to be able to, say, if I make these choices and what I click on, my feed will improve or not improve. But what we do know enough about is about the role that we all play as editors. And so, I think you can very effectively influence what your friends and family see. And that's because they see what you choose to share. So when Jevin and I teach the course at the University of Washington, we talk a lot of, we have a very simple rule about social media, which is we say, try to think more and share less. Slow down, read an article, don't just share it based on the headline. If it says something that seems too good or bad to be true, It probably is. So maybe back up a little bit and try to verify that and triangulate that. Are there other people saying that, or is this just one particular report that you're hearing? And then you can ask yourself questions about, well, is that report coming from a trusted source, or is that report something that someone with an anonymous username on Twitter has claimed that a friend told them, or that kind of thing.
Right.
I see that the slide is up. I'll just mention the one other thing that ties into everything that we're discussing, which is the importance, I think, of slowing down. And it really gets to the whole issue that you raised right at the start, which is that we get pulled into this sort of crisis mode cycle of thinking about how of trying to acquire information, and that can be harmful for us mentally, and also reduce the quality of the information we get. And so what I really strongly advocate for people is that they try, if they can, to slow down and recognize, look, this is a crisis unfolding in slow motion. It's not like a terrorist attack. You don't need information that's up to the minute. When you try to get information that's up to the minute, you end up getting pulled into a social media world where the information hasn't been verified. And so if you actually want the best possible information, you're much better off slowing down, picking a few of your trusted news sources, whatever they are, and reading those. You could set aside a time of day, perhaps, when you want to do this. You don't have to, but I think it's a good way to keep from getting, pulled into this over and over again. Say, okay, with breakfast, I'm going to sit down and I'm going to spend a few minutes looking to see what, maybe in my case, I'd look at the New York Times and the Washington Post, and there's a health sort of public-facing journal called Stat that's very, very good. I might look at some of those and see what they're saying. And then if I wasn't doing this for a living, then I'd move on and do whatever it is that I was doing for a living. And that can be a really, I think, good antidote to our very natural, evolved psychology to just keep seeking more and more information. We're in a time that's uncertain and sort of lacking control and scary because of that.
That's right. Yeah, I'm old enough to remember, Carl, when there were evening newspapers. And they would be delivered to your house in the afternoon, and that was when you got your hit of information.
Precisely.
That's how you had to wait. You could not get it instantly, and it didn't come to you instantaneously. So, yeah. Well,
I used to keep those in a bag over my shoulder.
We do want to hear from you, our audience. What questions do you have for Carl? Please leave them in the comments, and we will get to as many of them as we can. Carl, if I can, I'd like to talk to you a little bit about yourself and your use of social media. You use it to spread science and to combat misinformation, and you've got quite the Twitter following. I checked, about 100,000 followers. I think that's right. I ran those numbers past some teenagers in my household, and they evaluated that as, pretty decent, very decent, especially for an evolutionary biologist. So well done to you. I'm curious, what do you think Twitter is good for in your case, and what kinds of communication challenges are you seeing during this pandemic?
Well, I found that Twitter is a really good way to do public communication around science, especially when you have something where people are suddenly very, very interested in it. It has good and bad elements to it. Of course, the format is short and doesn't allow you to go into as much nuance as you like. And I have a habit of writing long threads because I'm a scientist, I guess, who likes
context. Crazy. So
that may not be ideal, but because it's short, I mean, I think it does allow people to get these little bites of information that allow you to track things, and then you can link to, of course, more detailed analyses and all of that. It's been really interesting on Twitter because a lot of the conversation that normally happens among scientists that might be happening by email or at conferences or on phone calls, because we're all trying to work very quickly and because we can't be meeting face to face. A lot of that is gravitated onto public social media. And so one of the things that's can be kind of fascinating, though it risks sucking you down that rabbit hole and doing exactly the opposite of what I was just suggesting, is, if you're interested in a particular aspect of this, particularly from a scientific perspective, you can actually see the discussions that might have been a little bit less accessible in the past. So I just taught this course at the University of Washington on it's usually on evolution in medicine, but this year is sort of on the evolution of medicine. It was on the evolution of our understanding of COVID. And we were watching the scientific debate about COVID unfolding in real time as people were trying to figure out what's going on, what's the case fatality rate, and how fast is it spreading, and what treatments are working, and all of the, how's the vaccine development process going. And one of the things the students found absolutely fascinating was that, instead of just seeing the final published papers, we're now seeing preprints that haven't yet been through review because people want to get the information out there as quickly as possible. And then we're seeing the review process happening essentially in real time on Twitter in public, where we see these discussions playing out. So that's
a highly
really
exposed theater, I have to say. That's not how it ends, right?
Right. So usually you've only been able to sit in the audience. You don't know what's going on backstage and all of the intrigue that's happening backstage. And now it's all out in the open for everybody to see, which has good and bad sides. We can come back to that about, if we want, about what it's like trying to do science during a highly politicized pandemic, particularly in public like this. The one other thing I just wanted to add that's been very, very useful for me about Twitter is, for me, it's been a very good way to be able to communicate with traditional media. And so, if something important comes out, I'll just give you one example. The CDC released a few weeks ago some numbers that they were proposing that everybody use for their modeling studies of COVID. And those numbers, in my opinion, and in the opinion of most professional epidemiologists, were much too optimistic with respect to the death rates associated with COVID. And so I noticed that the day it was released and put up a Twitter thread about it. Within a few hours, I was on the phone with CNN, and the next day, all the news outlets had stories about this. And so that's an empowering way that allows scientists to immediately interact with the with traditional media and get those stories that are important to traditional media. So I think that's, when used responsibly, and I certainly try to do that. Other people could judge, but that's a really positive development.
Right, but then there are the downsides to social media, which I know it's, it brings out the trolls and haters who have come after you on social. How do you keep the discourse civil when they are attacking your motives and sometimes even just the basis of science?
Yeah, it's you have to, I think it's tricky. I think, I try to be initially assume that people are operating in good faith. People who aren't tend to prove that pretty quickly. Given that there are a limited number of hours in the day and all of that, getting involved in these, not good faith discussions isn't really very valuable. And so it's really just a matter of sort of, screening the conversations that you're having and engaging with the people that are serious about the science, even if they don't agree with you. And those are some of the most useful ones, right? I mean, there are people that have, strongly disagreed with me about technical aspects of the modeling or whatever, and I've learned a ton from them and changed what I'm doing. And so it's really just focusing your effort that way, and then just saying, like, look, of course there's going to be people yelling at you, and that's the unfortunate nature, first of all, of the internet, second of all, of the fact that we've somehow managed to politicize very, very basic issues, like whether this virus is bad for you or whether it's just another cold.
It kind of dovetails with a question we're getting here from, and I hope I'm pronouncing this correctly, Triocton, and do forgive me, Triocton, if I've got that completely wrong. He's saying, hi, Carl, when there is so much misinformation and trolling on social media, how do you make the judgment for when to engage or challenge and when to just let it go? And I know you touched on that briefly, but do you have like certain criteria in mind?
It's really hard, and it is a judgment call. I think for me, because you risk sort of signal boosting the trolls if you engage with that, and then that the engagement actually bumps them up in the rankings of the algorithms, and then they appear on more people's screens, and then of course if someone is on there just simply to cause mayhem, that gives them a feeling of success and power when you start writing back to trolls and that sort of thing. So if it's just pure straight up trolls, you really want to avoid that. If there are people that are just spreading misinformation by accident or disinformation on purpose, I tend to look at how much traction that's getting, and so if there's an article or a blog post or something that's nonsense and nobody's paying attention to it, I don't want to signal boost it by explaining why it's wrong.
Right.
But if there's something that's starting to go viral, if it's starting to get picked up by the mainstream media, that sort of thing, and it's just false, I think it's really important to get the idea out there. So, one example would be there were two doctors who ran a clinic in Bakersfield who had done some very, very poor statistics. And based on these very poor statistics, were claiming that COVID was less bad than the flu. And this was, really, really hopelessly shoddy work. But once they started to show, once that started to go viral and they started to go on various news shows and things like that, it was time to engage and say, okay, this is wrong, and here's why it's wrong. It's wrong because these guys look, they estimated the prevalence of the disease among people who came seeking tests, and they assumed that everyone in the community had the same prevalence, which doesn't make any sense. The whole reason that people were in their sample was precisely because they thought they had it. And most of us don't think we have it, and are much less likely to have it. So you need to explain that kind of thing clearly.
Choosing your battles, obviously.
You got to choose your battles. I mean, it's, there's this cartoon that that you see going around. That's I think it's XKCD. It's like it's a guy saying, "Sorry, honey, I can't come to bed yet. There's something wrong on the internet." And so the whole thing is like, you can't get everything right on the internet before you go to bed.
I have a question for you about data and the role of data in stories, because we see that now all the time in stories about coronavirus. You have warned that data can be misleading. So can you just walk us through why it's harder for us to see when other people may be misrepresenting data?
I think we don't have the same training necessarily to challenge data that we do to challenge just, we're pretty good at picking up weasel words or kind of fallacious arguments that are just presented verbally. But with the data, first of all, data feel like they're sort of hard facts about the universe. They're not subjective things that people say, but of course there's so much subjectivity in the way that data can be collected and in the way that they can be presented. And then data can feel scary. They're often wrapped up in statistics and that kind of thing, which none of us feel very confident with, even if we work on them on a daily basis. It's just another level of sort of technical difficulty. And so for all these reasons, I think we tend to defer to data probably more than we should. And that's really a central focus of the course that I teach with Jeffin, is that you don't have to be a data scientist or a statistician to challenge data. You can just think about where the data are coming from and the ways that they're collected, and whether the conclusions people draw actually are merited by what the data show, and so on. So I think that's part of why we find it so easy to be misled by data. And then the other thing is just data becomes so important in society right now. We live in this world where there's unimaginable amounts of data compared to even 20 years ago. Everything we do sort of tracked by cell phones, and that data is available. And we live in a world where Internet of Things, and Google knows how often my refrigerator has to turn on, and my car company downloads everything about how I drive every time I take my car to the dealer, and all of that, right? And so data are used in so much decision making, and there is so much data out there.
And we've got a slide up here. Can you tell us what's?
Oh yeah, okay, sure. So then we turn to visualizations, right, to try to make sense of data. And unfortunately, there are ways that visualizations can deceive us. And so here's a graph that went around that shows hospitalizations, ICU admissions, and deaths from COVID for different age ranges. And when you look at this graph, what seems really striking about it is that hospitalizations and such are very rare for people 0 to 19, but it looks like the risk is about the same for people from age 20 on up. And you think, wow, COVID's worse than I thought for people in young adulthood. But when you look carefully at the graph, you see there's something really different between the age groups. So the first group is age 20 to 24. So that's 25. That's a 25-year range of people. Each of the next age groups is a 10-year age group. And so the bars are about the same height for that 20 to 24 age group as for the 45 to 54 age group. But that's only because there's 2.5 times as many people in that first group. And so the sort of initial feeling that you get looking at this graph, if you don't really slow down and analyze it carefully, is different than what the numbers are actually telling you. And that's so common. And it can happen because the designer makes a mistake, or it can happen because the designer is trying to push a particular impression. I think we might have another slide that, keep going one more, or there we are. This is a nice example. So this is a graph that was shown in one of the press conferences, White House press conferences of coronavirus testing. And the argument had been, wow, we're really ramping up testing. We're doing such a great job. America's testing more than anybody else.
And it's so uniform, Carl. Look at
I know, and you see the graph going up,
remarkable.
Up, and you think, wow, that's we really are ramping up testing. This is not the number of tests run per day. It doesn't say that anywhere on the graph, but what this actually is the cumulative number of tests. This is the total number of tests. So the fact that it's increasing uniformly actually means we're not increasing our testing capacity. It's that we're running new tests every day. But that graph, you look at that, you say, wow, that's an amazing explosion of testing capacity, and it makes you feel really good about what we're doing. Whereas if you were to present that graph as tests per day, you'd see that it was absolutely flatlined, and you'd say, like, how have we managed to not increase our testing capacity in this country when it's absolutely essential for fighting the virus? So this is an example of, even without faking the numbers, the designer has an enormous amount of power over how you feel about the numbers when putting them into a data graphic.
Right. And this touches on the area of politicization, about, as you say, taking a look at who's behind these figures that they're presenting to you, and that there may be an agenda there. There was a time when the White House would not have necessarily been seen up front when it comes to a public health crisis to be ones to be putting out data on that was misleading, but that we are now in a different time.
Mm-hmm.
And I'm just wondering if that has come as a surprise to you as a scientist working in this field for quite some time.
It did come as a surprise to me. I've spent 20 years preparing for something like what we're dealing with now, hoping it would never come. But preparing for it and thinking about how should we be planning as a nation for a pandemic. And we had a lot of debates over that period about, what is the role of government in pandemic planning, and how much should we be investing in advance, and that kind of thing. And those are sort of standard political conversations about the role of government and the scale of government expenditures, and where should it be coming from, and state level, federal level, et cetera. It never occurred to me while we were having all of these debates that if this, nightmare scenario ever came to pass, that we would be completely divided about whether it even existed, and that we would have, I assumed that if it actually happened, we would all be, on the same team at that point and trying to figure out how to best respond to it. And instead, what we saw was a concerted effort from the White House to deny the existence of the pandemic and the seriousness of the threat that stretched on for a matter of months. And that was a huge surprise. My colleagues in climate science just shake their heads at me and just think, you poor innocent child.
Rookie.
How could you possibly have expected that this would go on with those guys? But there we are.
So how have you adjusted then your presence or your approach on social media and just in the work you're doing in general, knowing that this is the environment in which we're operating?
I mean, I think it's very tricky. I think it's really important to try to put the science into context. I mean, there's something that happens. So, we talked about how the science is kind of taking place out in public now, in the public eye. And so, papers aren't going through peer review because we don't have time for that. They're being peer reviewed later. But before that happens, people are just posting their results immediately on the, for other scientists to see. What happens when you do that, of course, is you get a range of scientific results, ones that think that COVID is truly catastrophic, ones that think it's really very mild. And results on both sides get picked up by the, people with the aligning political incentives, and they use those sort of as weapons to batter the other side with. See that this study shows that COVID's less bad than flu. See, this study shows that COVID is as bad as SARS, whatever. And so to try to explain to the public that there's this range of scientific views, that just because somebody does a scientific paper that comes out over here on this side or over out here on this side doesn't mean that they're a bad scientist, doesn't mean that it's true. It's just part of the sorting through, and that it's very, very important when people try to evaluate where we are in the crisis that you don't just cherry pick the papers that happen to agree with the perspective that you're trying to present, but rather you engage with the totality of evidence. So I think maybe the most important thing that I've been trying to do is to come at it from that perspective and say, look, there is a totality of evidence here, and there's a range of different ideas and perspectives, and that's how science is supposed to work. And then as we learn more and more about this pandemic, that will filter down to smaller and smaller levels of uncertainty. But the thing to remember is that just over 6 months ago, this virus was not even circulating in human beings. I mean, this is something we know nothing about because we couldn't have, because it didn't even exist 7 months ago.
Yeah, and now look at where we are and just how it's changed our lives in such dramatic ways. And it continues. I mean, the time frame we're talking about, really, we don't know when the end of it is. And we are well. I mean, a lot of people have said, experts are expecting that we could be heading into this longer period where we see spikes and then drops in the numbers of infections, depending on how we respond to public health messaging. Each of those spikes and drops could trigger a flood of new information. Any tips for us on how we can consume information and not lose our minds?
Well, I think it's the same things we talked about before, really. I mean, I think is with respect to not losing our minds, one of the most important things is to, and it's getting easier with every passing day, I think, is to recognize the duration and pace of the crisis. Early on when we'd first heard about it and we'd only been worried about it for a week, it was still easy to feel like it was a fast-paced crisis. And now that we've all none of us can even remember, or at least people I've talked to, none of us can even remember what life was like in 2019 anymore. I mean, it's just, I like someone wrote on the internet, I remember places. It was like, I was thinking like, gosh, I almost remember places too. So I think we're kind of, getting better at understanding the pace of this, but in any case, to slow down, to be measured about our information consumption, and to, I continue to really strongly advocate that people find their own trusted sources, and rely on those a lot more than this, perpetually scrolling, treadmill of questionable information that we find on social media. I mean, it can be a good pointer to trusted sources, but I wouldn't use it as the arbiter of what's happening.
Right. So just remember your main principles in consuming information. Just stick with them, no matter what comes.
And slow down, and just recognize that we're all in this for the long haul. That there's nothing you're going to learn, this evening before you go to bed that you couldn't read tomorrow morning or tomorrow afternoon instead. We know basically what to do to keep our friends and family safe, and that while we want to stay in touch with what's happening, we can do that on a less frenetic timescale.
Yeah. Got a question sent in to us by Richard, who's asking if you have any view on why developed countries like the US and the United Kingdom have become so polarized and have had such poor responses. I'm assuming that's his evaluation in how we've responded to the pandemic.
Yeah.
Countries appear to have phenomenal scientists, but sideline them for politics.
I mean, I think the assessment is correct. I think that one argument is that the kind of long-term campaign, particularly around climate science, has eroded faith in science in the United States, and that there's been a sustained campaign to convince people that there are two sides to every scientific debate. Scientists can't be trusted, et cetera, and that has taken its toll over time. There may be elements of truth to that. I think we are generally, in the midst of, societies swing back and forth between, approximately, populist and technocratic, and we're in a strongly populist period where the opinions and views of experts are not valued as much, and there's a sense that the experts are in the in the employ of vested interests as opposed to providing truthful, valuable information. And I think that's contributing. So I mean, having this happen, having a pandemic happen during a very powerful sort of populist movement in the country is probably quite bad news, because it pulls you away from a reliance on expertise that you might have had in other times. So I think those are some of the reasons. I don't have a complete explanation for why this has happened. But yeah.
Right. Well, that's, yeah, it's a source of much discussion among political analysts, of course.
That's a great question. I wish I knew more about it.
Yeah, you mentioned the role of mainstream media, how that's a source for you, a trusted source. You also check on STAT, that medical newsletter. We got a question here from Justin B, and I'm just bringing this up because he's wondering if you have any virology or immunology or biostatistician researchers that you trust for solid information that you like to go to.
Yeah, I do. I mean, I have a short list of those. I should put together a little list on Twitter to provide the whole set. I mean, a lot of them turn out to be people that I know personally. Trevor Bedford here in the Seattle area is excellent. He was a major player in the Seattle Flu Project that originally discovered that COVID was circulating in the United States in the community, and has continued to provide extremely high quality information about what's happening with the virus. He studies how it evolves based on its DNA sequence or its RNA sequence, and tweets compellingly about that. And on the epidemiology front, Natalie Dean does wonderful analyses of things. She's an epidemiologist at the University of Florida. There are a number of other people, and then I really think ultimately you can't do better than following Helen Branswell, who knows all these people very, very well. And the sort of the inside secret is that all of us working in epidemiology get most of our news from Helen, because she knows everybody and finds everything out six to 24 hours before we do.
All right, good tip, Helen Branswell. I'm making more work for our producers even as we're speaking now, but we'll see what we can do about adding in links to those.
I can send you a short list of trusted sources as well.
All right, perfect. We can work on adding that in. We're wrapping up our time soon here. I just wanted to try to get in one more question from our audience, and this is kind of more of a forward-looking question when it comes to public health advice. This is from Raven Sarah. And again, forgive me, folks, if I'm mispronouncing that terribly. Who wants to know: do you have any tips for us, the general public, on how to use valid info to make personal decisions on when it's safe to eat out, when it's time to return to the workplace, and so on and so forth?
This is very, very hard. I think, I tend to recommend that people look first and foremost to their state and local health boards, because I feel like they understand the local context very, very well. This is not a nationwide pandemic. This is a set of many epidemics that are occurring at different times and rates and paces at different places of the country. And so local information is extremely valuable information. I also think, given the politicization of everything that's happening, I feel like the more local you get, the less likely they are to have been subject to heavy political pressure the way that, say, CDC is. It's very, very sad for me to have to say that, but the CDC has clearly had to buckle to some serious pressure from the White House. And so that would really be a very, very good place to start. I think that you can try to read and analyze the information yourself. I just, for what it's worth, I've been doing this for 20 years, and I am highly uncertain about things myself, and find myself struggling to make decisions about what is and is not acceptable levels of risk. And then I guess the other key thing is to take into account the personal and family factors about whether there are, whether there are high risk patients in your immediate bubble, or whether you yourself are at high risk, and so on, and that matters. But read the trusted sources, pay attention to state and local health, and take your own circumstances into account, and that's, I think, the best any of us can do.
Yeah, these are difficult times, and we're all trying to figure out our own best way.
I mean, the other thing, sorry, just one other thing that's occurring to me. Call your healthcare provider. If you have the ability to be able to call a healthcare provider, that's going to give you very personalized information. So, and they're often very happy to hear from you and to help you work through these kinds of decisions as well.
Well, Carl, we are running up against the limits of our time. So I just want to say thank you so much for your help in this conversation. It's just been a real pleasure speaking with you.
Yeah, likewise. Thanks, Kim. It was really great to be here, and I appreciate your hosting me.
Thank you, and such great questions from our audience as well.
Thanks, everybody.
Thank you. Yeah, Carl Bergstrom is faculty affiliate at the Center for an Informed Public. He's also a professor at the University of Washington's Biology Department. If you have not been able to take Carl and Jevin West's very popular class at the University of Washington, their book, Calling Bull SH and then asterisk, I think you can fill in the blank there. It's out on August 4th. Is that still the correct date, Carl?
That is the correct date. We're excited about that. And
excellent. Congratulations.
Yeah, thank you. It's not COVID specific because we had it turned in before any of our realities shifted, but it is all about how to think about media and data and information in the world where that's so prevalent.
It is hard to imagine a better timed book right now. I'm sure your publicists are just delighted. Well, you can follow Carl on Twitter as well, and his handle is CT_Bergstrom, and that's BERGSTROM. From everyone at KUOW and our partner, the Center for an Informed Public, thank you so much for joining us for Stand with the Facts. You can visit kuow.org/standwiththefacts to access the toolkit, and it's got links and resources on spotting misinformation and how to address it. And just want to let you know about next time. Stand with the Facts, we continue on Tuesday, July 7th, and it's happening at 1 in the afternoon with Kate Starbird. She and I will be discussing research on how bots and trolls target social media users on both sides of the aisle during a crisis. You can register for that event and watch past events at kuow.org/standwiththefacts. Thank you, everybody. We will see you next time.